So I'm cooking dinner for the fam. Bacon turkey burgers. That is my dog Tank, in case y'all didn't know. Some sweet potato fries, baked beans. Kids want to bring anything. So yeah, I just wanted to talk about, so today is day 2 of our first real week at work dealing with COVID-19. I am in the healthcare industry, so this is why I am still working. Most people that are not essential employees, i.e. Hospitals, first responders, grocery store employees, the dollar store salesmen, but they do sell groceries. But yeah, most places are closed. So I mainly wanted, one, to document this. Sorry, I'm not in the view of the camera, obviously, because I'm cooking. But I did want to document this for 2 reasons. One, I'm in the healthcare industry, and 2, we're going to look back on this one day, and I want to show my kids what they've been through, what they survived. Yeah. So, for obvious reasons, there will be certain things that I will not talk about. I work in Nashville, in a doctor's office at a hospital there. In my office, we specialize in diabetic wound care for the most part. A lot of our patients are diabetic, so a lot of them could possibly lose their lives or limbs or lives if they are not getting proper care. Stop it, Tank. So, business has slowed down a lot. Last week, which was the first week where we started getting cases in Tennessee, Nashville, I want to say, we only had 1 physician in. 3 of our other doctors were out on vacation. So this is the first week with staff and physicians to see how this thing is playing out. And things are slow. Obviously, we've had a decrease in our patients, basically because a lot of our patients are sick in general. So they're in nursing homes or rehab facilities, things like that. So those places are like basically under a mandatory quarantine. So that means that they cannot have people to enter, and they are not leaving and able to return. If you're in the hospital, no visitors unless you are basically at the point to where you could be saying your last words. I mean, everything is on lockdown. You can't enter certain doors. There are desks set up at entrances to basically screen you and see if you've been traveling. Are you sick? Do you have any symptoms? I try not to watch the news as much as possible. I have 2 little boys, 3 and 5, and one, I need to stay in a positive mindset, because if I'm in a positive mindset, they're in a positive mindset. They have no clue what's going on. They know that a lot of people are sick, and it's important that we wash our hands more now than ever. But that's the only thing that they are really aware of. They wouldn't understand. Most adults don't understand, so certainly kids wouldn't. But with that being said, that is a reason why I feel like it is important for me to maintain my sanity and my perfect peace. Like, I'm aware that this is a serious situation going on, and I feel like I get updates when needed, but to sit and drown myself in this all day could be detrimental to my health and my mental health, should I say, and my state of mind. Like, I'm not allowing anyone or anything to tell me anything different other than, you know, we will survive this. Like, everything happens for a reason. Oh, okay. And whatever that reason is, I have faith that God will bring us through it. Yeah, at this point, so work has been different this week. Today, I only worked a half a day, meaning I left work at 12 and came home. We only had morning clinic for 3 doctors and then 1 doctor this afternoon. Mainly because we are trying to minimize the amount of people in the waiting area at this point. Only 10 people should be in small rooms at a time. So we've pretty much thinned out our schedule, and doing our best to keep, you know, things moving, so people don't have to be around each other. Yeah. So lots of businesses are suffering. Lots of people are scared because they're not working. Some people are off work with pay. Some people are not getting paid. And it can be a scary time. You know what I mean? Like, this is a serious thing, and I don't think people in the U.S. took it that serious. You know what I mean? When it all popped off, if you will. So yeah, I worked a half a day. It rained here all day. I came home, cleaned up a little bit. Now I am cooking dinner and gonna work on my business a little bit before I go to bed and prepare to start tomorrow. Tomorrow, as of right now, we have as of when I left work. Tomorrow's looking actually better than any day this week so far. So tomorrow, I think it's 20, at least it was when I left work. That could have changed. I had 20 patients that was on the schedule for me to see tomorrow. Tomorrow's Thursday, so that's Wednesday. So we have 3 physicians in the morning and 2 physicians in the afternoon. So with my doctor, we are scheduled to see 20. Now that number has changed because normally on a regular day, we have like 21 patients in the morning. And it's alone, you know, that's not even including the afternoon. So yeah, things are thinning out, but you know, thankfully we still have a job. And hopefully it won't get to that point to where we are out of work. But we work for some really good people who are doing their best to ensure that, you know, we are working, and if we're not, trying to have things in place for us so, you know, we are still able to get paychecks. So, yeah. I'm not sure of the exact number. Let's see. I can find out how many in Nashville are affected currently. All right, so Tennessee, this is as of 4 hours ago. Tennessee confirmed cases of COVID-19 now at 773. Metro health officials confirmed 253 cases of COVID-19 in Davidson. Okay, so Davidson County is the county in which I work, which is in Nashville. I live in Montgomery County, okay? Which is on a day with no traffic, because that is one perk to, you know, everyone working from home or not working. When I tell, sorry, frying bacon. When I tell you the traffic has been absolutely amazing, like non-existent. So yeah, that's one upside to this whole matter. But yeah, so that is a lot of cases. It is increasing, and as it increases, you know, I don't know what, you know, the officials want to do. A lot of major cities are shutting down, totally putting everyone on a mandatory 15-day quarantine. So yeah, we'll see what our future holds as far as that goes. And I don't know if I'll do this daily or not. We'll see. I might do it daily though. So yeah, I'm going to get off here and finish cooking my dinner. If there are any major updates to all this, I will report it. If not, then see you when I see you.